Welcome to the Essential Therapies podcast. Dr. Cindy Hodgson here. I'm a physical therapist, exercise physiologist, and this channel is all about essential therapies to help you feel great and do more. So we use all kinds of information regarding fascia, the myofascial release of John F. Barnes' approach, and other things. So today I'm super excited to have on a guest who has experienced John Barnes' myofascial release and is a MELT instructor like me. That's how we met. So that's kind of fun to share. And we are also going to be offering MELT courses by this special guest. So this is great timing to tie all of this in. So I have with us today Amy Brown, coming from Colorado Springs. Yay, a little bit different place than here. Amy has had a past background in some healthcare, being for over 20 years, I believe, a lactation specialist, which is very near and dear to my heart because that was a big part of my life for a few years at least. But she's not doing that now. She is enjoying her life in Colorado and has a small business that she will tell you about, teaching MELT, which is really an amazing self-care tool. So I am going to hand it over to you now, Amy, where you can tell a little bit more about yourself, if you will, and just tell us a little bit about your journey, how you got here.
Thanks, Cindy. So almost 2.5 years ago, I was 3 months into a 1-year recovery from a multi-level spinal fusion. And at my 90-day post-op, my surgeon finally approved me to do more than just his physical therapy that he prescribed. So I hadn't been able to bend, lift, or twist for 90 days. And I was only doing exercises that were approved by him and his PTs, in addition to some walking and a little bit of movement in the water. And at 90 days, he released me to go do almost anything, not quite the things I wanted to do most in life, but which was ride my mule. But I could go and do Pilates or yoga or, some gym exercises and things like that. So I had always wanted to try Pilates. And every time I tried it before my surgery, it was a total fail for me because of my long-standing injuries in my spine. But I finally got into the Pilates studio and started doing that. And somewhere along the way, I saw some advertisements for MELT, and it was geared towards chronic pain. And I just got very curious. And the studio owner said, "Oh, I was going to tell you about that. I had you in mind. I think this would be perfect for you." So I took an intro session and I got hooked right away. And as soon as I took the intro session in the Pilates studio, I started doing some research on it myself. And really just sort of vetting the whole method because I'm very hesitant to embrace any kind of method. After having had 30 some years of back pain, everybody has a method that they want to give you that will, end your pain. And most of them ended up injuring me more. So I was very cautious, but I did a ton of research and I really just fell in love with the method and everything that it embodied. And I took a few more classes, and it wasn't long before I signed up for instructor training and for a retreat where I met you in Utah a few months later. So I'm now a level 3 certified instructor. And next week we'll be opening my own studio in Colorado Springs where I'll be teaching classes. And I have another instructor coming alongside me who's also level 3. And we'll be able to reach the city of Colorado Springs. And when we go online, I can reach your people too.
Awesome. And give us the name of your business so that people know how to look you up.
I am Beyond the Back, and my website is gobeyondtheback.com. And I have a Facebook page under Beyond the Back also.
Awesome. So you mentioned roughly 30 years of dealing with back pain. So doing this work of myofascial release, I see people who've been in back pain for many, many years. Can you give us a little bit of that history?
Sure. When I was 19, I wasn't super athletic, but I was fit and I was active and I was young and thought I was healthy. And I bent over and picked up my nephew. And when I did that, I just completely blew up 3 discs. And we didn't know that at the time because nobody does any kind of MRI on the spine of a healthy, active 19-year-old in 1991. It was a long process. I went through a year of being very undertreated, largely because every time I would show up at a doctor's office or the emergency room, they thought I was looking for drugs because there was no way that I could have been injured that severely. So it was a year before I even had an MRI. And in that year, I suffered quite a bit of damage to the nerves in my right leg. And it was my L34, L45, and L5S1 discs that I herniated. And really, my L5S1 was a real blowout. It was pretty bad. So I had the MRI and was called in for emergency surgery, but unfortunately, I'd had the MRI done in Washington, D.C., and I was back here in summer school at University of Colorado. So I couldn't go in for emergency surgery. But I did go in a few weeks later when I was finally able to get home and had double laminectomies. So they left the L34. It was, they said, very ineffective and quite dangerous to do the 3 levels if you didn't absolutely have to. So they did 2. And I was supposed to be out of pain immediately, and I wasn't. It took a couple of weeks. I was in the hospital for a full week back then. It took a couple of weeks before I had any inkling that it might have been a successful surgery. So it was a little bit of a complicated recovery. And eventually my leg pain went away for the most part. But like most people, I did end up reherniating, and I reherniated many, many times over the next several years. I got married a year after my surgery, and wasn't long before I started wanting babies and having babies, wanting to have babies, breastfeeding babies, having babies again makes for a difficult scene when you need to have a major surgery. So I kept putting it off. And over the years, as I reherniated, things got very complicated in there. And there were times when I had surgeons who said, you need surgery immediately. And I said no for one reason or another in my life. Or there were times when I thought I couldn't handle it anymore. And I had a surgeon who said, there's nothing wrong with you. And of course, there was a lot wrong. And it got to the point where I couldn't stand it anymore. In 2020, I broke my tailbone falling out of a tree. And I stirred something up. Not only did I break my tailbone, but I definitely stirred something up. And there was a grip in my left glute that was unbearable. My before and after photos, before and after surgery are really sad to look at. I was hunched over. I looked like a little old woman. I couldn't stand up straight. I couldn't walk for any length of time. I had to cross a lot of activities off of my list: cocktail parties, weddings, museums, any kind of show, anywhere that I had to walk any distance or stand for any period of time. I just couldn't do it. And it got to the point where I could tell that I was suffering even more damage in my left leg this time. Had been my right leg in my initial surgery. So I guess I waited for the right doctor and the right technique and the right time. And so I got a fabulous surgeon who, as far as I know, did a minimally invasive surgery. So he didn't have to cut through so much stuff. They dilate the muscle and they dilate it again, and they dilate it bigger and bigger. And so I don't have the cuts that I got from the first surgery. And I'm glad now that I was able to wait that technology out. I don't know how long it's been around, but it's around now. And so in November of 2021, I had my L45 and L5S1 fused. It ended up being a very complicated surgery. Those lower 2 discs had ossified into bone, and they were on my nerves. And a lot of that did not show up. Well, none of that showed up on the MRI. I did end up with an upright MRI. That was the last one that I had, last MRI that I had. And it was the first time I had ever had an upright MRI. And the results of that were completely different. So from everything that I had before, I'm really grateful for that step, because that allowed us to make a better judgment on the surgery. So I had the fusion, and they had to drill and chisel those discs out, which is not the standard procedure. And as a result, I had a lot of nerve pain coming out of it that I had never had before, because things got stirred up so much during that very complicated surgery. And it was a very scary process. Coming out of it with pain, I expected. but coming out of it with leg pain that I had never had before was, it was a panic. It was a real panic mode for me. So, and then I just developed a hematoma / seroma on top of everything else inside of there. Took us several weeks to wait out. My surgeon gets everybody started in PT at 2 weeks instead of 3 months. And I found myself very grateful for that as well. I was unable to start at 2 weeks because of that. But we had to wait for that inflammation to go down. But I got started shortly after that and was in PT twice a week in Denver, which is almost an hour away, for 5.5 months. And it helped. I knew when I found Melt that there was a lot going on in my PT that was very good for me and that I could not do without. But I also knew that there was sort of this missing link between this is my body and this is real life. And PT fits in somewhere here, but it's not filling this big, huge gap. And I really felt at the time that Melt was this whole new experience that filled a void that traditional PT, and I would say my PT was less traditional than traditional PT, but not what you do. So it was much more traditional than what you do, but not as traditional as, the factory PT, where you have, one therapist working with several patients at a time. I didn't have that, but it wasn't global enough. It wasn't touchy-feely enough, honestly. It was still a little bit sterile for what I needed to be able to close that gap and be able to do the things in my life that I wanted to do. So Melt, I was still in PT when I started Melt. And I remember they tried to, you've had your hands on my quads. You know what they're like. And they got me on a traditional foam roller in PT, and I had just found Melt. And when they put me on that foam roller in PT, I cried. It was one of the only times I ever cried in PT. It hurt so much. And I said, I cannot do this. And they said, oh, you need to do this. Well, I've heard that before, right? And I said, I cannot do this. It hurts too much. And I said, I have an alternative. And they said, oh, great, you have an alternative, use it. So I did. And we never got on that traditional foam roller in PT again. So it got approved. It's fine. Do whatever you have to do. But it was the difference between those two was, oh, this feels good. And oh, this is making me cry. It was that intense. Yeah. So anyway, I got through that first year and got back on my mule and got certified to teach and have been teaching off and on since then and still use Melt almost every single day. And I still share it with people on the trail or, in an office or wherever they happen to be that I can find someplace to help them improve their situation.
Awesome. So prior to Melt, did you know much about fascia in the way that you do now?
Not in the way that I do now. It was on my radar. I have had a wonderful, not a physical therapist, but actually a personal trainer who works alongside a chiropractor who's not a standard chiropractor either. And so we have touched on it some, but not to this extent. No.
Mm-hmm. Right. So, and I have to bring this up about the traditional foam roller because I have had this happen multiple times. I see a lot of patients who have been through traditional therapy, sometimes multiple times. And it has been more than a couple times that I have had a patient tell me that they were using these hard rollers, rolling the heck out of their thighs, literally got bruising from it. And sometimes they were so compliant that they just kept doing this to themselves every day, even though it was painful because, people get into this mode of like, oh, it hurts and I'm supposed to be doing it, so it must be good. And like, they'll push themselves through this kind of pain. And so I think that's what's so awesome about your story is that you understand this. And so we have people who have all kinds of histories and backgrounds with pain, and to have an instructor understand where they are or somewhat in that arena of pain is really important, and that you shouldn't be pushing through pain and thinking that, well, it must be okay because they're telling me to do it. So
Yeah, it's one of my favorite things about melt is that if it hurts, you don't do it. And in the upper levels of melt, there are some things that are quite difficult. The neuro strength moves are not easy moves, even for very, very seasoned athletes. They're difficult moves, but they shouldn't hurt. And
Right.
if you're hurting, then we talk a lot about in melt how we're really talking to our nervous system, and we're sort of massaging and soothing our nervous system. And when we go into that place where it hurts, then you're not helping your nervous system to calm down. And I learned this years ago through this personal trainer that I referenced, where he said, your body is reacting. He said, it's not that I don't think you have pain or that you should have pain in this certain scenario. It's not that I'm saying it's all in your head, but he said, your body is reacting to a perceived threat with the same amount of force as it would to a real threat. So whether the threat was real or not, as soon as my brain perceived a threat, I got into this guarding mode that I had a really hard time getting out of. And the threat may never have come, but once I got the signal, my body went in overdrive for that. And so the great thing about melt is, one, we try not to go into that place where it hurts. And two, if it does, we back off. But we address the fact that pain signal it's like an assault to your nervous system for right now. And then we have to work to counter that. So we try to avoid that. And we talk in melt about the pre-pain signals. So we do our assessments, and like you have your calm technique, we have our assess and our reassess and melt. And we're looking for those little things like, where is the imbalance and where is the asymmetry, and where is the discomfort, and what bone is poking into the floor that shouldn't be, and can you make your butt cheeks a little more fluffy? Those sorts of things. And we use those as a guide. And where you find, oh, this shoulder blade, when I'm doing this assessment, it's really stuck into the floor. And then after I melt, it's not, well, that's a pre-pain signal. And we'd like you to treat that with melt before it becomes a screaming pain and you have to go and do 5 hours of MFR a day. So
Right.
we can use this to help make other things easier, make other techniques like MFR easier, but also to just avoid those chronic and acute pain situations.
Mm-hmm. Yeah, that's one of the things which I'll bring up now that I really like about melt, and how that is parallel to some of the principles that we use in the John Barnes Myofascial Release Approach, is we do not force the tissue. There is no benefit in forcing tissue, and that's often hard to find. The other thing is that we are honoring the barrier in a sense. Like you're bringing that awareness. It's so much about awareness. And when I first was introduced to melt, which was in 2020 during the British Fascia Symposium, which I was planning to actually attend initially. Of course, we know that didn't happen. But I was introduced to Sue Hitzman and melt at that point in time. And I remember thinking, wow, the 4 R's, and I'll let you go into that in just a moment, is so similar to my calm technique. I mean, this is what I coined several years ago, is that we have to connect and we have to assess the body, and then we further listen, and then we move into whatever it is we're going to do, or we allow the body to move. So that's such a great comparison with these two ideas. So with that, why don't we have, and we can talk more about MFR in a bit, and how that kind of added to your self-treatment regimen down the road. But let's talk about melt. How would you describe what is melt? And when you're doing an intro or explain to people what is this and how is it different? I'll let you just take the ball with that, pun intended.
I think the simple explanation is that it's a gentle self-care technique that's scientifically proven to reduce pain, improve mobility, and enhance general well-being. And I think that covers everybody. If you have pain, we can help you. If you're having mobility issues, let us see what we can do there. There's probably something that we can do. Balance, we can get in on that. But even if you don't have chronic pain, you're not injured, you're not a fall risk, whatever, we can just enhance general well-being. And maybe general well-being means that you breathe a little bit more easily because we've, done some special breathing techniques. Maybe it means we enhance sleep for you. We help you enhance your sleep. Maybe it means, you just have that one finger that doesn't work great, or a little bit of foot pain. We can very directly address things. We generally go indirectly rather than directly. So if you come in and say you have back pain, we're probably not going to get to your back for several weeks, but you'll probably notice some improvement in whatever it was that was bothering you before then. So it's just very gentle, and it's respectful of what the body is saying, and it can apply to every body in some way or another.
And honoring the fascia, which is what,
Mhm.
of course, we're all about, and just really fully understanding what that means. So how would you, and you mentioned even the finger, which I think is great. I have my little balls here actually. Um, two of these balls I think are so amazing, and I love when I first started teaching classes, which I went through the certification. That's how you and I met. I'm level two, and then you've gone on, which is awesome. I was blown away because I was hearing people like yourself, and it was at that course that I heard other instructors saying, "Yeah, I had chronic back pain. I used this ball for 2 to 3 weeks straight every day on this protocol, and they felt a difference." And to me, knowing that this is honoring the fascia, my ears were perked up. Like, okay, I got to start teaching this class. So, tell us a little bit about your experience with the balls, and how you incorporate and how you just start with all of this.
Well, my personal experience with the balls is that I'm running out of them because I take them everywhere. I keep one of these in every vehicle, every purse, every tote bag. And, I use them a lot when I'm driving. Just I'm at a stoplight, and especially on long drives, because, I do long drives.
Mhm.
And, across the state of Colorado is an all day deal. At gripping the steering wheel, any kind of repetitive motion with the hand, we can conquer with these balls. So there's a large soft, a large firm, a small soft, and a small firm. And we do different things with them. And we do like to know ahead of time if you have any injuries or diagnoses in your hand, because it does make a difference how we treat. And then we also use them on the feet. And a lot of the back pain issues can be addressed starting with the balls on the feet. And we go gently there too. And of course, it always helps to know there if you have any diagnoses or pain or issues, so that we can make sure we treat that appropriately too. But I also use mine a lot on my face and my jaw,
Mhm.
and when I can't get on a roller, I'll use it on the base of my skull, and especially while driving for long periods of time, and also being in the saddle. As I ride a mule, and get lots of tension through here. So these are super handy to have anywhere. And I love the complete set. It's two of each one. And or you can just do a custom kit where you make your own, but I keep them handy everywhere, and I give them to everyone. Yeah, and there's a little band that comes in the set. I think mine is probably long gone. It's called a
Yeah.
bunion band for particular treatments. It's good for more than just bunions. So if you have any kind of foot issue, then we can help with that. It's really an interesting technique and quite effective. I think that the best way to convince someone to try melt is to give them a quick foot demo, because I've never seen anybody do a foot demo that hasn't benefited from it. And it's immediate. The results are immediate.
Absolutely. I love giving myself a foot demo regularly. I have it right in there in the bathroom. So if I'm brushing my teeth and it's right there on the floor, I can do some quick things. It's really quite amazing. I remember when I was first introduced to this, like I said, as I'm sitting there in my living room watching the British Fascia Symposium on Zoom, I didn't actually have melt products at that point. And I couldn't wait. I, of course, ordered them immediately, and I was watching the mail every day to be able to use them, and just how these flow together with the whole self-care idea of not forcing. But I had never thought of using them or something like this on the hands and feet and face. And I have to say, I just love the actual protocol. And I think a lot of people will grab this ball and think, oh, I can do stuff with that, right? It's different. Like the actual protocol that you will carry people through,
Yeah.
there's something to it. There's absolutely something to it. And so just kind of rubbing it and thinking that's enough is not complete.
There's so much more to it, and it's so effective. I will never get on a surfboard or a paddleboard or anything like that without melting my feet first. And I don't have full sensation in my left foot, but the most sensation I ever have in my left foot is after I melt. I mean, even
Wow.
more than a massage. The melt gets in there even more than a massage. And then my balance is so much better after I have melted my feet. And I don't do racket sports, and I haven't lifted heavy in a long time, but people who lift and do racket sports say the same thing about their hands, that they absolutely feel so much better when they do a treatment on their hands before and possibly after having their hands wrapped around bars or rackets.
Well, and as a therapist, doing MFR for 8 to 10 hours a day, or people who do massage or anything with their hands.
Yeah.
Yeah, how you're really getting into the forearm. A lot of times you might not have hand pain or issues or tightness, but maybe in the forearm. So there's some great forearm techniques, which I think are just so extremely helpful.
Yes, and that carries through all the way up the arm and into the shoulder and into the neck. And then the feet will carry up all the way through the lower back. And really, it's such it's such a great opener for the other techniques, just to help get things started. And you can do your hands in 2 or 3 minutes, or your feet in 2 or 3 minutes, a mini treatment. And if you want to come back to it later and do more, you can. But Sue introduced us to the fact that when you get very coordinated, you can brush your teeth and melt your feet at the same time. And lots of people say they put their melt ball by their coffee maker, and they just work their hands or work their feet while they're waiting on their coffee in the morning. So it's lots of things, lots of ways you can incorporate that into your day without having to say, I'm going to take half an hour to melt right now, because it doesn't take half an hour to do your hands or your feet.
Absolutely. So speaking of how great these are, let's go into the roller. And so you've already kind of touched on that a little bit, but give us your thoughts on the roller, and I'll chime in too after.
Okay. So the regular roller, here's the regular roller. And we call it the regular roller because we have some variations on it. And one of them is the half roller. And you can see it's just cut in half. So you have a flat side and you have a curved side, and we can talk about what that's for. And you have yours there too. And then we call this either a performance or a travel roller. Yes. See how bendy that roller is? This one's not, because it's smaller, but they're much more flexible than your traditional roller. This one will fit in a carry-on suitcase. So I take mine with me when I travel, if I have space. But they are softer and they're grippy. We have a Melt logo on here. Mine's kind of hard to see. There you go. You can see the Melt logo. Yeah. And other than the fact that it is the Melt logo, it does help with the traction or friction, or however you want to describe it, when you're on the roller. There are times when you kind of want to have that grippy feel to it. But we most of the time start everybody on this full roller, and it's also smaller than a traditional roller. So there are some positions where a traditional roller would be too high, and mostly would be a problem on your pelvis. So in that case, this is the solution for most people. If you have back pain or certain injuries, then we'll probably start you on the half. And there are some things that we would do curved side up, and that's just less height for your if you're putting your pelvis on the roller. And there are some things that we would do flat side up. If your spine itself actually hurts, then a lot of times this is more comfortable to be lying the length of the roller on this side up. This does come with some limitations. So anytime we're going to be moving the roller, gliding on the roller, you obviously can't do it on this one. So whenever we teach classes live, we have everything handy. If you want to come into a class and you aren't sure what roller might be appropriate for you because of certain injuries or whatever, Cindy and I can talk to you and give you our best advice for what to purchase that would be best for you. And it may be more than one, but if you can only do one, then we'll help you figure out which one would be the best bang for your buck.
Yeah. Yeah, I struggle with that a lot because I do love this half roller, even though I can certainly tolerate this full roller. There's a lot of things I do with the half. So um, I don't know. It is an individual thing. I steer a lot of people. Just yesterday, I steered somebody towards the half, and the day before, I sent the link for this one to somebody else. So it's definitely, if you can get them both, I tell people they're great to have both of them.
Yeah.
If you're going to get one now and one later, then we'll talk about that. So
Yeah. Yep. I agree.
So,
They're all handy to have.
So how do you start people? Like if someone wanted to join a class, so we're going to start offering classes here virtually. Um, can they just jump in? Like give some feedback about the best way to begin and how the classes run.
The best way would be to start from the beginning, but that doesn't happen all the time. So you can jump in at any time. The best way to learn the lingo of melt is to melt. And the easiest, fastest way to do that is to start with hands and feet. And so we almost always start with hands and feet. Sometimes it helps we call it flip the map. So a map is the sequence of events for the class. And sometimes we'll flip it and do the hands and feet at the end. But usually we start that at the beginning. And so the best way I think to start is just to get everybody familiar with a more lengthy hand and foot treatment, because then you get a lot of the terms of melt that are also going to carry over into the use of the roller. And it's easier to pick that up when you're doing hands and feet than it is to dive straight into the roller. But the best sequence that I have found is an intro session. And that is a hand and a foot treatment and a rebalance sequence. And that's on the roller, lying the length of the roller. And that way you learn some of the foundation exercises that will carry through and that you will use for other moves. You'll learn how the difference between a pelvic tuck and a tilt. And that can be different than what you may have learned somewhere else. So you'll learn how we describe it in melt, because then you're going to use those moves for other things. It's very simple. It's very easy to figure out. And we teach you how to find a sound, find your core, and find a sound that helps you dial into finding your core, because there will be times when you need to do that preceding a move. And those are sort of the things that encompass the intro session. And then after that, if we have time, we go into everybody's favorite, which is a neck release. And if we have time, we can do some upper body compression and some lower body compression and lengthening. And so we have different types of moves, and it really depends on the group and how many questions there are, how much you can pack into an intro session.
Right. So I think it's important to mention, I was just thinking how we're really focusing on the hydration of the tissue. Can you tell a little bit about that?
Yeah, so melt has 4 R's. And just makes it kind of easy to remember. So we reconnect. So we always do, just like Cindy's calm technique, we always do an assessment. So we assess our hands, we assess our feet, we assess our whole body, and we just scan through the body in a particular procedure. And we take the time to do that. And then afterwards, we reassess. But you have to reconnect. You have to know what you're feeling and what might be presenting a pre-pain signal, what might be causing a pre-pain signal. And then afterwards, when you reassess, you can judge what that session has done for you. And then we like to rebalance. And so we talked about that rebalance sequence. A sequence is a group of moves that we put together in melt. And the rebalance sequence involves finding that breath, and is very relaxing and very calming. And you can tap into your nervous system and sort of take it over and tell it to calm down. And so that's a real good one to know. And, even when you don't have a roller handy, you can go through the breathing motion. If you're, stressed out in traffic, or, at the courthouse or the grocery store, or whatever it is, that just going through those moves can really help you center and calm yourself. And then we rehydrate, which is through the compression techniques. So it might be, with the ball, or it could be on the roller. And that's bringing those supple qualities back to the fascia, restoring the qualities that you want there in the fascia, rather than what we call in melt stuck stress. So the stuck stress is just dehydrated connective tissue. And it happens because we're injured. It happens even if we're not injured. It happens just through daily living and repetitive motions and just life. And we can very simply and comfortably rehydrate that tissue through the use of the melt tools. And then we can release. So we have a neck release and we have a low back release. And we go through. I usually do a release in every class. The neck release seems to work for almost everybody, and the back release just depends on where people are. So we almost always do one or both of those. And I, when I did MFR with you, I was doing. We had multiple sessions a day, and I tried to get in a hand and foot, quick hand and foot, and definitely a neck, because I had so many issues in my neck, a neck release. And then, if I had time, then I would do as much compression, upper body, just real simple upper body compression and some lengthening and a little bit of lower body compression and lengthening also. And I think that it probably enhanced the MFR in such that you might have spent a little bit less time getting in because it took a lot longer to get in than you were expecting. And maybe if I hadn't done that, it could have taken even longer. So I think it was an enhancement for that process. I could certainly feel the difference, especially when I did a little bit of rehydrating before, and then I would do it a little bit after and get the lengthening in after that. The lengthening moves are often hard for me to know that they worked, but I felt like they worked best when I did a little rehydration, the MFR, and then a little bit of rehydration and the lengthening. It was really a win-win.
Yeah. So I'll just clarify that too, in that when you're talking about the time, I would agree. And your tissue is very hard, right? So when we're wanting to soften tissue and hydrate tissue, and with melt, I feel like it's not like it's taking less time for what we are looking for in MFR, which is what we refer to just as a release or a softening or lengthening of the tissue, where we actually feel that shift and that change. But and we talk about this even based on research. We know that the collagen takes time to change shape, right? And that's what we're trying to get to with MFR. So, but at the very bare minimum, the actual change in that shape happens around 5 minutes. So that might not change, but there are many times. Yesterday, I was holding one release for 20 minutes on a patient because it took that long to get the change in tissue. So what if there was some melting first? It might not have been 20 minutes. It might have been 10. I mean,
Right.
we don't know, but I think also it helps the participant become or stay more connected and aware of their body and their tissues, because they can feel the difference when they're using this technique. I am curious too for yourself, when you learned about myofascial release a bit. Can you comment a little bit there as to how that was different for you, and just maybe expanded your understanding or how you felt about the fascia in your own body?
Well, I'll be real honest. I think that my fascia was beyond being fixed by melt. And go ahead.
No, go ahead. Yeah.
I I know that melt has great value, but I had reached a place where I felt like I'm not making progress. Unwinding, is the exact term used in MFR, and it is the exact term that applies to what my body needed. I was not going to unwind completely through melt. I might be making, every day, if I got up and melted, I would feel better than if I hadn't. But I needed to progress. On Tuesday, I needed to be farther than I was on Monday. And on Thursday, I wanted to be farther than I was on Tuesday. And I had reached a point where I didn't think I was getting those benefits anymore. And the myofascial release was what got me past that and really did unwind that fascia. And I think that it's now my job to make sure that I don't go back to that place And some of that is through techniques that you taught me, and some of that is through melt. But it's a combination and it's a balance. I do both.
Yeah. I remember you saying earlier, before we had treatment, that there were things you wanted to be able to do this summer. You wanted to be able to ride your mule. You wanted to be able to experience the outdoors and do the things that, were near and dear to your heart. So I can remember that being a key thing, right? So how do you feel that helped you to be able to maintain, or to be able to do? I know you've had a lot of great rides this summer. So how did that work for you?
I had a 17-mile ride in the Lagarita Wilderness, and it was a rough ride. It was several thousand feet, a couple thousand feet up and a couple thousand feet down. It was difficult. It was difficult navigation. It was difficult riding for my mule. It was difficult for me. And 17 miles is beyond my comfort zone. I didn't know going into it. I was getting into 17 miles. And as you know, I got out of the saddle and I was hurting. But I survived it. And my husband, who is extremely fit and athletic, was also hurting when he got out of the saddle. And that kind of made me feel better, because you know what? Most people 50 and over who ride 17 miles a day in the wilderness of Colorado, backcountry wilderness of Colorado, they're going to hurt when they get out of the saddle. And so, it actually made me realize that I'm not the only one that hurts. But I did it. I really did it. I've had a couple of 14-mile rides. Had another one last week that was actually the most technical ride that we have had. We went up 3,250 feet in elevation, almost to tree line, and came back down. And the down is sometimes harder than the up. Very, very tricky technical terrain, long ride. Long day, 14.5-hour day from door to door. And those are the things that are very difficult for me. And I did drive that day. And I have to say that, it's it ended up being almost a 3-hour drive, because I had to pick somebody up. So a long drive, a long ride, and then a long drive again. And coming home in the dark, I was pretty spent, but I survived that. And the next day, I was in a little bit of pain that evening. I think my friend probably was too, and she doesn't carry the issues that I do. But I took a hot bath and did my stuff, my self-care stuff, and I was okay the next day. It did not carry through to the next day, meaning it didn't harm me. It was a little hurtful at the time, but it didn't harm me long term. So I have found that I bounce back. Yes, it hurts to be in the saddle for 17 hours at a time, but it doesn't stop me, and it doesn't carry over to the next day. It's not an injury. It's just I worked hard today. It would be like, you ran 10 miles when you don't usually run 10 miles. Yeah, you're probably going to hurt. It's that kind of discomfort. And that's different. That's very different from what I had before. I could be set back for several days by pushing beyond my limits before. So my limits have moved, and my ability to exceed my limits is greater than it used to be. So my endurance is up. I end up with a burn. It's actually not in my low back, and it's not leg pain like it was before. It's now up, my neck and my traps mostly. And Cindy's helped me figure it out, some little tricks along the way. I do put a yoga strap in my saddle bag. And as long as I'm not out riding a thunderstorm, I do stop and do legs up a tree or a boulder or my mule or whatever I put my legs up. And I use the yoga strap and do some hip strap and some trapezius stretch. And I also have melt balls in my saddle bags and in my truck. So I keep at it as much as I can. I've developed a way to lengthen my arm, because I've got some pretty serious issues in my neck and my shoulder here. And I've developed a way to lengthen my arm in the saddle and pump a piece of the leather, the edge of the leather, so that I get some circulation and everything, some movement and contraction of this muscle, and really concentrate on keeping these shoulders down while I'm riding, because it's very easy to do this, especially if you're nervous and you've got hands forward driving and hands forward with the reins. And so it really could be a recipe for disaster. But adding the MFR and getting this unwinding in the neck was huge in helping me get to those goals this summer of being able to ride that long.
Oh, awesome. Thank you so much for sharing that. To look at your photos and the things that you do, it's just amazing to me. Like,
don't try it at home.
No, I mean, to hear your history at the beginning of this and know what you've been through and know how your self-care and treatment has gotten you to be able to do what you do. And this is so much what I want people to experience, is that I want you to be able to feel good so you can do more. I mean, that's the whole idea. Like, what can we do for ourselves? And finding the right tools and treatments and consistency and making it a priority so that we can enjoy life so much more.
Mhm.
And for me, that's the bottom line, right? I want to be able to do the things that I enjoy and feel good while I'm doing it. And so it makes it worthwhile, and to make these self-care things a priority. And I think I love, using the melt along with the things that I do. It's definitely honoring this portion of the body we call fascia and all of the things that go along with that. But they're two very different techniques, but they utilize this awareness and this connection. So I think they just go together so, so well. And I'm so excited that you're going to be able to offer this class. I mean, I've done a little bit of classes here, but my time is needed elsewhere. So I'm not able to offer the classes that I wish I could, that I know my patients need. So give us just a little bit of how you see, so for people who are considering joining the class, what it will be like, and then we can let them know how we will make it available.
Yeah, we need to settle the time and the date and all that sort of thing. But we'll do in every session a hand and a foot, and we'll start with our basic compression or rehydration techniques and a little bit of lengthening. And there's a lot that we can do just there. And we'll try to do a little bit of everything every single week. I like to make sure that as we progress, we always do something that we've already done so that you can master it. And we usually do something new. And then everybody hopefully gets something that applies, that is of great interest to them. And I'm certainly open to requests, like, hey, we did that hip to heel press last week, but it just doesn't feel right. Can we revisit that? Sure, we'll throw it in, or we'll, replace it with replace something else with that. So I'm flexible. I would say that if anybody wants to join and they have a serious injury diagnosis, some kind of pain, whatever, it would be very helpful to know that ahead of time so that we can prepare with what will be a likely modification for you. And that's one of the beautiful things about Melt. And, I modify life. You were saying you look at the pictures of what I do, and it's crazy what I'm able to do on the spine that I have, and the after effects. I do have what may be some nerve damage that I'm not getting over, and it's very complicating. And I modify everything I do. If you saw me get on my mule, you would probably suspect that I had an artificial spine. It's awkward. It is not graceful. It is sometimes unsafe looking how we have to do this. But once I get in the saddle, I'm able to go. We modify lots of things. So we also modify Melt. And if you have some kind of injury, or you have an artificial knee or hip, or I have torn labrum in my shoulder, there are some things I don't do. There are some things I do differently. We would like to know these things ahead of time. So I would say, let Cindy know, and we can communicate and be ready. And there may be a time when your modifications are so specific that we might need some time to research that, and we don't want to leave you out. So we might just give you something else to do while we're doing something that isn't appropriate for you. So if you think that it sounds like, oh, it sounds too yoga-like, or it sounds too Pilates-like for me, it's not. It's a whole different thing. It really doesn't even count as exercise. It is more in the self-care category than it is an exercise. And if you think, well, I can't do this or I can't do that, we probably have a modification for you. So let us know and let us do some research and be prepared for you, because we want to help you. We might be able to get you standing on a wall instead of getting in the floor. We might be able to help you from a chair. We might even be able to help you from bed, if that's what it entails. But all of those things can be accommodated. If you have any special considerations like age, if you have osteoporosis, if your body composition, if you're very thin or very overweight, you just need extra support or those sorts of things, injuries, pregnancy, those are the sorts of things that we need to know about. We have some limitations for you if you're pregnant, depending on, where you are in your pregnancy. So lots of things to consider, but we'll try to work everybody in and make sure that everybody gets addressed and taken care of.
Absolutely. And then there's always the option for even a one-on-one session for people who want to have something really specific to them. And especially, I think the biggest part is that we want you to learn so that you can do these things on your own in between classes. Classes are great to always know you have a class coming up is great because it keeps you in the game. I know that's always been the case for me. It helps me when I'm teaching classes, but even when I was just taking classes and various things in life, right? It's like, okay, you kind of do your own thing and it might not be as complete as what it is when you go to the class, right? So when you know that, okay, I'm going to be melting with Amy on whatever day it is, you're going to get your full thing in, but that's going to teach you something new. I love how you mentioned teaching you something new and reviewing it so that you can take that to your own program. It's not something that you're going to necessarily learn immediately, but with the practice of a routine class, it helps to drill that in so that you can do this throughout your week and then have a more complete day where you're really getting a full session in and learning new things. It's just, I'm so excited to be able to offer this. So,
and if you can't come, if you can't come every week, then it's still helpful to come when you can. I tell my in-person students that, if you only come once a month, you're still probably going to review something and you're still probably going to get something new. So yes, you're going to miss out, but come and get fine-tuned when you can and get a set of eyes on what you're doing, because the modifications, some of the moves, the modification is this much. I mean, it really is not, it's something, if the modification is only this big, then trust me when I say you don't know that you need it. You just don't know until you're there. You might be, you might have your pelvis in a tuck when it should be in a tilt, very easy to do. And usually we can see those things. So that's the benefit of doing something, either in person or online. But yes, we want you to keep doing it at home, and you will progress much more if you do it at home. So, come as often as you can, but don't feel like if you missed a week that you can't pick up where you left off. You most certainly can.
Absolutely. You can always just pop in there and just kind of get a refresher, and we will have that available as well. Any final thoughts, Amy, as we're closing this up here today?
No, I think that's about it. I think that you can make some progress on your own, and you can also enhance all the other techniques, whatever they are, whether it's MFR or any of the other techniques that you're using, by doing the melt. And get in there and do your hands and your feet and your face, and you will definitely notice the difference. And once you notice the difference, I think that you'll want more of it. You'll want to know how you can do this on a regular basis.
Absolutely. And I find it to be one of the most important things of tools, right? I don't have a lot of tools in the techniques that I teach people because you can do a lot just with yourself and a wall. But as far as my toolbox, melt products are absolutely in there, and it's really a great option to be able to have and to be able to add with all these other things. So, okay, well, thank you so much again. And if, maybe down the road we'll have more questions or thoughts or things to answer for people. But in the meanwhile, we are going to be rolling this out here very soon. And stay tuned. I'll put links in the comments here so that you can find us, and all of that will be on our website. And Amy's as well if you're out in Colorado Springs, because how fun to be able to do it in person. That's always great. But thankfully we don't have to just do in person, and we get to have you join us now. So welcome, Amy, and thanks again. And happy trails.
Cindy.
All right. And we will see you again next time.
All right. Bye-bye.